most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about 5 tests to determine if you have a pinched nerve in your neck. Let's get right into it, Brad. So,
yeah, why waste time?
a pinched nerve means there's pressure applied to a nerve as it's exiting the neck.
Right.
It comes into your arms and provides sensation and strength. Now, the pressure could be from a disc. It could be from a bony, like, overgrowth.
You're right.
Spur, I suppose. It could be from muscle even. Muscle
Sure.
can tighten up over.
Some inflammation if maybe they
Yep.
had some trauma or whatever reason. But
Yep.
yeah, the nerve becomes irritated up here, impinged, sends symptoms and pain down the arm all the way to the fingertips sometimes.
And that's the number one thing. We'll first talk about 5 things you might see, and then
Sure.
we'll show you 5 tests.
Yep.
You might see, pain radiating to the arm, and especially if it goes beyond the elbow.
Yes.
Because regular pain can even go to the elbow.
Right. Or
But-
sometimes shoulder pain will radiate down,
Right,
typically
right.
to the elbow.
If you have hand, arm, or shoulder weakness, that could be a pinched nerve. It could be other things too, so you always want to make sure you're going to a doctor to check these things out.
Yeah.
If you have numbness or decreased sensation in your arm, wrist, or hand. Now, this again could be carpal tunnel, or
Yeah,
it could
they overlap, and
Yep,
this is one of those tough ones that's not always easy to.
it could be pinched
clarify.
nerve anywhere. It could be a pinched nerve in your elbow that
Right.
can send pain down to your forearm and hand. All right, if you have tingling, pins and needles sensations, the same thing down in this area.
Right.
That would often or can be a sign of a pinched nerve in
Sure.
the neck. So sometimes you have both. Pain in the arm, wrist, and hand, which is aggravated by any neck movements.
Yep.
So like if you move your neck and, that hurts down here.
Yes.
That's a pretty
right.
good sign, actually, that you have a pinched nerve. And-
Go ahead. Before you finish, I want to add one more, I think.
All right. Feeling the hand fall asleep, which, on my hand will fall asleep if I sleep with my arms up over my head.
Right, yeah.
But
yeah.
if it's falling asleep and you're not really doing anything to it, it could be a pinched
Yeah.
nerve.
Turn around once, Bob.
Sure.
Another all the way around. There we go. So if you're having pain in the shoulder blade area, that's a good possibility it's coming from the low neck too. Typically, shoulder pain goes down the arm or in front. It doesn't refer backwards. So that's another thing to keep in mind as well. And sometimes you get shoulder pain and then it radiates down.
Right, right. So good point, Brad. So, all right. I'm going to have Mike now put up an image of the nerves in your hand. We have what is called dermatones in our hands. And when you have, each nerve provides sensation to a certain part of the hand.
Right.
So like the medium nerve is more like the thumb and the 2.5 digits, usually. And so if there's numbness and tingling or pain in this area, that might be your median nerve.
Sure.
Ulnar nerve is over on this side,
Pinky.
and then radial nerve is in the back.
Right. So all 3 of these nerves come from different levels out of the neck. They go down they form into one nerve in the brachial plexus through the shoulder, and then they start to branch off. And it's really like a map.
Sure, and it can kind of give you a sensation. Like, if it's the median nerve, that's often, that is the carpal tunnel nerve.
Yep.
So that'd be a sign that maybe you do have carpal tunnel, or maybe you have a pinched median nerve up at the neck. So,
Or you could have both.
yep, you could have both. So we're going to show you 5 tests now. The first one's for the median nerve.
Okay.
So you just take your arm
You gonna
out like
smack
this.
me?
Yeah, I'm going to smack you. You bend it down like this. And one thing you might find, that I find quite often, Brad, is that if you have a good arm and an involved arm, the good arm, the wrist will bend forward further than the bad one or the involved one.
So you could do the bad side,
yeah,
and then go over to the side that's symptom-free.
I'd do it probably the good side first.
Sure,
So you can know what it feels like.
But not at the same time.
Not at the same time. So you bend it, and then you bend your neck away.
Yeah.
So you bend the wrist and then bend your neck away.
Elbow needs to be straight.
Straight, yep. That's putting a lot of stress on that nerve is what you're doing. So same way on this side, you bend away.
So you get it up level and tilt your head away.
Yep.
Not looking, but sideways.
So this next one's a little weird. So this is the ulnar nerve. So to get the ulnar nerve, you make a circle like this,
Yeah.
and you actually bring your wrist to like this. Now, what I found with a lot of people, they can't even get it very far. They can only
Yeah.
go like this.
Yeah. If
But
you're younger, you can. usually.
Yeah, if you got good motion of the ulnar nerve, you can get all you're trying to make an eyeglass,
Yeah,
basically.
but don't do this at the same time.
Yeah.
But that, when we were kids, we used to do
Yeah,
that.
yeah.
That's how I remembered it in PT school.
Right. So you test it, and then you actually can bend away while you're doing it. There you go. And if that brings on pain, that might be your ulnar nerve involved. Radial nerve. So you're going to stand. I'm going to go ahead and stand on this one, Brad. Face away, and then you're going to lift up like this
Okay.
and bend away at the same time. So stand, face the palm away, palm up to the ceiling, bend neck away, and
And you should do that standing up.
well, it's hard to do.
Oh,
here,
because
you know.
yeah. So if you're off the edge like this one,
Yeah,
could
you
do
could
it.
certainly do it.
I just
now.
thought we'd clarify it.
Yeah. All right. These are a little bit easier tests, I think, to do. So the neck compression test, it's called SPURLING's test or SPURLING test. This is an overall to check kind of all the nerves here.
Yep.
And what you're going to do is you're going to extend your head and tilt to the painful side. Then you can actually apply a little pressure, gentle pressure.
Straight down.
Yeah, straight down. And you're compressing the spine together, and you're closing off those holes, the
Right.
foramen. And if there's a pinched nerve there from that area, it's going to make it worse.
Now, if you just do this, that might be enough
Right.
to irritate it and cause.
Yeah.
You don't have to
You
continue.
don't have to
with
go
it.
any further
Yeah.
then. Same thing if you're going to do the other side. You're going to extend the head, tilt to that side, and you can, like I said, apply a little pressure if you want to.
overpressure.
Yeah.
Typically, it's the arm that's not involved because the other one's going to hurt and it kind of gets in
Yeah.
the way.
Now this is the opposite of this. This is once you check out, see if you get relief from a position. So let's say I'm having pain in this arm here.
Yep.
I'm going to put it on a pillow and support it,
Sure.
and I'm going to tilt away. And now I'm opening the holes up here. There's plenty of room now for the nerve to come through. It's being supported. And does this give you pain relief? Well, if it does, then you may have a nerve issue.
Yep.
And that's actually a lot of times with people having nerve problems, I actually have them use a pillow all the
Sure.
time
Yep.
because it provides some relief, even if it's a shoulder problem too.
Right.
So,
Exactly. Now, that one, it's possible if I got a patient and they do this and it hurts down here, or this, sometimes that way it'll pinch it more. But, if it's a bulging disc, that might actually push it out a little bit.
It
too.
might. It
So-
could make it worse, but
Yeah.
generally, I don't think it pushes it out enough to cause a problem. But I see what you're saying. I see what you're saying.
So really, associated neck movement creates pain down
Right,
here.
right.
It's probably up there and not
Yeah.
carpal tunnel.
Good point, Brad. Very good point. So, all right, this video is part of a series of videos on neck pain. They're all free. Just go to bobandbrad.com.
That's right.
Go to the program section, look for neck pain. And Brad?
Along with it, we have a PDF printout with a review of the video and exercises, pictures of them. It's a wonderful way to know exactly what you're going to do. You don't have to come back and look at us, and we don't expect anything from you. Well,
back
Bob,
and look
why
at
would
us.
they want to keep looking at us? They got a
That's
piece of
true.
paper,
Yeah, and there's like 20, 30 videos, I believe, on neck pain. Just watch the ones that pertain to you.
Right, just look at the titles. They're usually around 10 minutes or less.
So there we go. This one's only 9.
Take care.
Thanks.